Senate links climate change to public health crisis. Climate change, framed as a growing health emergency. On July 10th, 2025, a group of Democratic senators introduced a resolution declaring climate change a serious and growing threat to public health in the United States. Led by Senator Edward Markey, DMA, the resolution calls for stronger federal action to help communities and health systems respond to the health risks linked to extreme weather, air pollution, and rising temperatures. What's at risk? The resolution highlights how climate change is already harming people across the country, especially those who are most vulnerable. It points to more asthma and respiratory problems from wildfire smoke and pollution, higher risks of heart attacks and strokes during heat waves, waterborne illnesses that already affect millions each year, mental health struggles tied to disasters like PTSD and depression, pregnancy complications linked to extreme heat, displacement and homelessness caused by floods, storms, and wildfires. Children, people with disabilities, low-income communities, and tribal nations are facing the worst of these impacts. A call for federal action. The resolution urges the Department of Health and Human Services and other agencies to fund hospital upgrades, clean energy projects, and emergency preparedness efforts, especially in underserved communities. Restore and support offices focused on climate and environmental justice. Provide rural and tribal health systems with tools and guidance to adapt. Help workers stay safe from extreme heat by setting national standards. Improve public access to clear, local health data on climate threats. It also calls attention to the healthcare sector's role in the problem. It contributes about 8.5% of U.S. carbon emissions and urges hospitals to reduce their environmental impact while becoming more resilient. Will it pass? This resolution doesn't create new laws, but it sends a strong message. With only Democratic support and no Republican co-sponsors, it's unlikely to move forward in the current Senate. However, it may influence future funding and planning decisions, especially as federal agencies begin to factor climate into health programs and infrastructure investments. In 2024 alone, the U.S. experienced 27 climate disasters that each caused more than $1 billion in damage. As events like these become more common, efforts like this resolution aim to shift the conversation from crisis response to long-term public health planning. You've been listening to Sustainability Soundbites from E+E Leader, where the business of sustainability meets real-world impact. Thanks for being a loyal listener. To inquire about brand partnership opportunities, reach out to a member of the E+E Leader team.